Presentation of robotic process automation on a grand scale at the FDA. A pilot robotic process automation program to improve operational efficiencies within finance at the FDA has quickly evolved into a scaled capability operating more bots than any other federal agency. Soon after Torres Rivera joined the U.S. Food and Drug Administration in 2016 as Deputy CFO, her boss, CFO Jay Tyler, asked her to take on the task of improving the agency's inefficient and highly manual vendor invoice and payments processes. In this Q&A, Torres Rivera discusses the planning and execution of the FDA's robotic process automation implementation and lessons learned. She also explains how an initial pilot evolved into a scaled robotics capability in a managed service, the largest RPA deployment in the federal government. Torres Rivera, our invoice and payments process is high volume, both in terms of number of invoices and the amount of transactional, manual, and repetitive work required to process them. For example, we have to ensure the line totals match the total amount on each invoice, a highly manual and error-prone task because the invoices can be 50 pages long, with 500 or more lines of data, and come in multiple formats. The financial system does not permit the invoice to be off by even 1 cent. With RPA, we now have bots performing the data entry and doing those calculations. People come into the process to validate the bot's work and to perform analytical steps to ensure timely processing of payments. RPA is also cost-effective. The bots can operate 24/7, 365 days a year without interruption as long as the information and the environment they rely on are available and working properly. Since implementing RPA, we have been able to process more than 500,000 lines of unpaid invoice data and have saved about 6,000 hours of manual labor, freeing up employees to perform higher value work. Our vendor payments process uses several disparate IT platforms that don't communicate with each other. We develop bots that bring together those different data points and systems to automate the creation of reports that communicate to the FDA program and acquisitions offices what they need to do to process the invoices. We also deploy bots to automate data collection for employee performance metrics associated with the vendor invoice and payments process. The bots use these metrics to create a performance measurement dashboard. The enhanced reporting capability aligns with goals established in the Department of Health and Human Services strategic plan aimed at improving performance and meeting government-wide objectives such as modernization, improved transparency, and accountability to Congress and taxpayer. What steps were critical to successfully implementing RPA at the FDA? We started by identifying which steps in the process would most benefit from automation, those that were rules-based, manual, time-consuming, and error-prone. For instance, determining whether each invoice is in compliance with the Prompt Payment Act requires verification that every one of them includes 12 compliance elements across multiple invoice formats. That complexity made this part of the process an ideal fit for RPA. Then, for the pilot RPA project, we identified 4 vendors who submit a high volume of invoices and whose invoices have the most line items. As finance people, we recognize that technology and cybersecurity are not our areas of expertise. So from the very outset I made sure we collaborated closely on the implementation with the FDA's Office of the CIO and Office of the Chief Information Security Officer. Working together ensured that all aspects of the implementation were considered and that we aligned all stakeholders across the organization on the benefits and dependencies of operating the bots. The implementation was a true team effort among the 3 FDA organizations. Our collaboration included conducting the cost-benefit analysis of alternatives, determining the different operational processes, controls, systems, and governance frameworks that implementing RPA would require, getting the RPA software approved, purchasing the licenses and servers, and testing the bots. Another important element was designing a process to help employees work effectively with our new digital workforce. For instance, we trained the bots to alert our human workforce when the bots could not perform a task because of missing information. That allows the bots to run unattended while enabling people to intervene and correct issues that might arise. Why did you make RPA a managed service instead of running it in-house? We determined that a third-party managed service would be the most efficient and cost-effective way to scale our RPA capability. For instance, we decided that training and recruiting FDA staff to manage and maintain the bots is unfeasible at this time because of resource constraints. Our managed services contract covers technical support to ensure the bots are operating optimally and to retrain them to accommodate changes in our IT infrastructure. It also gives us more financial flexibility if we want to shift to a different technology down the road, or if, for example, a new government-wide initiative changes these processes so we no longer need the bots. What are some lessons learned from the pilot implementation to share with other government organizations considering RPA? During the pilot planning, our approach to implementing RPA evolved to a decision to develop a scalable RPA capability and run it as a managed service, because we quickly understood that RPA's value could be deployed across the organization. We have identified several use cases where RPA can help us become better stewards of taxpayers' dollars, increase employee morale, and perform tasks more efficiently and effectively. For example, we have recently implemented the first interagency bots. FDA bots log into other federal government agency sites to download data such as the FDA's interagency payments, collections, and other financial reports. I can't emphasize enough the importance of focusing on change management, especially for people worried that automation could endanger their jobs. Even though we put a lot of effort into ensuring employees understood how using RPA would benefit them, there was still a fair amount of concern, and even resistance, until people actually saw how well it worked and how it improved their jobs. From the outset of implementations, we now include the people whose jobs are affected by RPA in the decision-making and planning process. That goes a long way toward accelerating employee buy-in.